Good afternoon, dear friends. This is Natalia on the Doctor Online channel. After taking a complete blood test and discovering an increased platelet count, many of us lose our peace of mind. And what level of platelets in a complete blood test is considered elevated? At what platelet count should we be alarmed? And is it possible to get vaccinated if platelets are elevated? So the condition in which an increased number of platelets is detected in the blood is called thrombocytosis. Let me call things by their proper names. Who among us can be diagnosed with thrombocytosis? The causes of this condition can be infectious, inflammatory, and autoimmune diseases, as well as malignant tumors of the hematopoietic system. One of the causes of thrombocytosis is iron deficiency anemia, especially in cases where we are dealing with chronic blood loss. For example, a situation with prolonged menstruation in women of reproductive age. Normally, the upper limit of platelets ranges from 350 to 400,000 per microliter, which depends on the reference intervals of the specific laboratory where the test was performed. Some of us, when platelet levels rise above 400,000, immediately start to panic. Don't worry about this, because an increase in platelets up to 700,000 per microliter is generally considered mild thrombocytosis. Moderate thrombocytosis is observed when platelet levels are between 700,000 and 900,000, while severe cases range from 900,000 to 1 million. A special form of thrombocytosis is the so-called extreme thrombocytosis, in which the platelet count rises above 1 million. Most often, the cause of severe and extreme thrombocytosis is oncological blood diseases. And can platelets be elevated within the normal range without the presence of any diseases? And there are a whole range of reasons for this. Short-term thrombocytosis can occur during stress and excessive physical exertion. In the case of dehydration, you should pay attention to such a blood indicator as hematocrit. It is included in any general blood test. So, with dehydration, this indicator will definitely be elevated. In addition, mild thrombocytosis can also be observed in children up to 11 years old. A fairly common cause of thrombocytosis in about 40% of cases is infectious diseases such as inflammation of the lungs, kidneys, brain, the inner lining of the heart, as well as tuberculosis and sepsis, viral and fungal infections. In addition, helminthic invasions, in particular ascariasis and toxocariasis. Chronic diseases of a rheumatological profile, especially those with an autoimmune component of inflammation, can often cause thrombocytosis. For example, rheumatoid arthritis, systemic lupus erythematosus, nonspecific ulcerative colitis, and Crohn's disease. The most severe forms of thrombocytosis are observed in the presence of systemic vasculitis. In these situations, a large amount of tumor necrosis factor is synthesized, which stimulates the formation of platelets. One of the rarest causes of thrombocytosis is the removal of the spleen. This usually occurs about a week after the surgery and reaches its maximum by the end of the second week. Then, over the course of several weeks or months, it returns to normal. Massive tissue damage can also be a cause of increased thrombocytosis. I mean fractures, burns, and abdominal surgeries. In addition, thrombocytosis is found in small cell lung cancer and colon adenocarcinoma. And is it necessary to take aspirin to prevent blood clots in thrombocytosis? Of course, in some cases, antiplatelet agents are prescribed for this purpose, and primarily acetylsalicylic acid preparations. And what should be done in cases where aspirin is contraindicated? For example, in cases of peptic ulcer disease of the stomach and duodenum, in this case, platelet receptor blockers are used. I mean clopidogrel and ticagrelor. There are situations where the risk of thrombosis is very high. These are elderly people suffering from diabetes and atrial fibrillation. In this case, anticoagulants such as frapharine, Pradaxa, and Eliquis, among others, are used. Fortunately, mild and moderate thrombocytosis is much more common, for which thrombosis is not typical. But in severe or extreme thrombocytosis, the risk of developing fatal conditions is quite high. And first and foremost, strokes and heart attacks. One of the important questions today that is receiving special attention is whether it is possible to get vaccinated against coronavirus if platelet levels are elevated. None of the vaccines contain direct contraindications for people with blood clotting disorders. Although there are studies that have shown that the formation of blood clots is characteristic of a number of vaccines that use adenovirus as a vector. From my point of view, if there is a tendency to form blood clots, it is better to get vaccinated with vaccines that contain inactivated whole severe acute respiratory syndrome, COVID-2 virus. For the sake of fairness, it should be said that an increase in platelets by itself does not indicate thrombosis. However, if platelets are significantly elevated, you should take precautions and use blood-thinning medications, primarily aspirin. It prevents platelets from sticking together. In addition, with a high platelet count, you should also check your blood clotting indicators, and only if they are within normal values can you get vaccinated. And I also recommend you watch this video where I analyze the factors that contribute to thrombosis and answer the question of how to avoid it. Stay healthy, dear friends, and see you next time.